Now we want to get the latest updates from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. Alex Garza is also Chief Medical Officer for SSM Health, joining us live this afternoon. Dr. Garza, thank you again for your time.
Afternoon.
You reported just about a half hour ago this afternoon that the positivity rate for testing in our region is now at 11.5%, which is the highest ever. Does that number need to be in the low single digits to suggest that at some point we can have this under control?
Yeah, anytime, most people agree that anytime you're above 10 means that you're not having great control of the virus spreading in your community. So we've seen that number gradually increase since really the late parts of June, going through up until now. That number kept going up. So yes, we do need to see that number come down before we feel comfortable saying we've turned the corner on the transmission in the community.
You also reported this afternoon that the reproduction number has fallen in the last week or so to below 1. So does that mean our spike in cases here in our area is easing just a bit?
It is turning a little bit. It's starting to flatten, and so most of the data that we're looking at has shown a good turn, meaning the cases are coming down, the admission data is coming down, and all of that contributes to that reproductive number. And so the reproductive number is really an estimate. It's based off of all of those other statistics that we look at. But as I think everybody knows, anything below 1 means you've interrupted transmission, and so that's a good sign. But we still got a lot of virus circulating in the community, and so it's going to take continued vigilance, continued effort to keep that number going down.
We still keep hearing from parents. I'm sure you do as well. So many parents do want their kids back in the classroom for in-school teaching this fall. So with the combined total number of COVID-19 deaths in all of Missouri, all of Illinois, for those under the age of 20 being a total of 6, would that right there, that number, be an indication that kids could go back with the correct safety precautions in place?
Well, I think it's a little bit too early to tell right now. As we've said before, mortality is usually a lagging indicator, and so sometimes you won't see those numbers for a little bit of time after we've seen that spike in cases. The good things that we got going for us, though, are the cases are starting to turn. And I think, as everybody knows, children aren't as impacted by the virus as other age groups are. But still, that doesn't mean that there's no risk of transmission to others, other family members, teachers, support people, things like that. So I would say let's give it a little bit of time. Let's see which direction the cases are heading, see if we can get this transmission under control, and then we can reevaluate to see if it's safe.
All right, Dr. Garza joining us live again this afternoon. As always, we appreciate your time.